Welcome to Doctors In. Today I'm gonna be your hostess, Lulia Hobby. Today we have with us Dr. Hameed, specialist urologist, working at International Modern Hospital with 12 years of rich experience in the urology field. And his area of interest is endoscopy and laparoscopy surgery for kidney stones. Dr. Shamir, please tell us what is urology and what does urologists do?
Well, urology is a surgical subspecialty wherein we deal with the diseases of the bladder, kidneys and the prostate. In one single term, we can call it as urinary system. So it deals with the disease of the urinary system of both males and females. And apart from that, there is a small division of urology which is called as andrology, wherein we deal with the diseases of the male sex hormones, sex glands, sexual glands, and disorders of infertility.
What are the most common urological diseases in UAE?
See, most of the urology problems are common in old age. So the most common old age urology problem is regarding the prostate gland. When it gets enlarged, usually the males will have symptoms of urinary difficulty, and the other problem which we see in them is infection of the urine. Then coming to younger age group between around 30 to 40, the more common disease is the formation of stones in the kidneys. And the formation of stones in the kidneys are most common in the Middle East because of the climate, the food habits. There are various reasons. We'll be coming to that. Then in children, we get bedwetting in the night, which is called as nocturnal enuresis. Usually children get control over their urination by the age of 2 years, but some, they may get delayed over a period of maybe 6 to 7 years. So that is called as nocturnal enuresis. Then in ladies, we have infection of the urinary system, which is very common. Apart from that, the main problems what ladies are facing is involuntary loss of urine, that is urinary leak. It is called as urinary incontinence. Which can be of various types. There are cancers of the urinary system, the cancer affecting the kidneys, it can affect the bladder, and it can even affect the prostate. So these are the various diseases which can affect.
What symptoms should prompt a patient to make a visit to the urologist?
The common symptoms which will prompt a patient to the urology clinic are frequency of urination, wherein the patient visits the washroom very frequently. Then the next one is the force of urination will be very low and it can even break in between. The urination can even break in between, and the most dangerous is a blood-stained urine. Even one episode of blood-stained urine also should be taken very seriously and should take the consultation of a doctor, nearest doctor. Then apart from that, the patient will have a sense of incomplete emptying. He may pass urine, but he will still feel that there is something left behind. Then it will break in between intermittency. We call it intermittency. Then in the night, he may wake up two to three times, which is called as nocturia. Waking up in the night more than once is abnormal. So these are the symptoms which you should you should be alert and you should meet a urologist.
And we are talking about different genders and different ages.
Yes.
Same symptoms.
And once there is for example, if there is a cancer of kidney or prostate, and if that tumor has spread to different organ like bone or other part of the body, then you will have related symptoms like back pain, loss of appetite, and you lose weight. Other things.
How many times a day does a healthy person urinate?
In general, a healthy adult voids or urinates once in every 2 to 4 hours. That makes around 6 to 8 times in 24 hours. Urination frequency depends upon various factors. Number one, the amount of water you take, the size of the body, and the dehydration status of the body.
Of course.
If the body is dehydrated, naturally the kidneys will preserve more water from urine, and the urine volume will be less. Apart from this, some of the diseases like diabetes, then pregnancy as such, and prostate disease and urinary tract infection can lead to increased urinary frequency. And apart from that, some medicines can also affect the urination.
Dr. Shamir, please tell us about the causes and symptoms of incontinence in men and women.
Urinary incontinence is a common and an embarrassing problem wherein the bladder loses its capacity to hold urine for enough time. So there are various types, and the most common is stress urinary incontinence. Means when the patient makes a stress, like increase in the abdominal pressure, like coughing, sneezing, or lifting a weight, his abdominal pressure increases. Normally, when the abdominal pressure is increased, we are not going to lose or leak the urine. But when there is stress urinary incontinence, the patient leaks urine without his knowledge. That is the type number 1, stress urinary. And the second type is urge urinary incontinence. Here, what happens is the patient will get the sense to pass urine, the first urge to get pass urine. By the time he reaches the washroom, he's going to pass urine.
He can't control it.
He cannot hold it.
Yeah.
And the third type is the mixed, both stress and the urge. And in the fourth type, it is called as overflow incontinence. When there is a block to the outflow of urine from bladder, like prostate gland enlargement, what happens is that the urine is collected inside the bladder more than its capacity. So what happens is they'll reach a point when bladder can't hold anymore. So if the capacity is around 700 ml, the bladder will be holding around 1000 ml. Then after that, it will start dribbling down.
Yeah.
So that is the fourth type. Then the urinary incontinence is more common in ladies, and it is mostly a stress urinary incontinence type, wherein the urine goes without any control when she increases the abdominal pressure. So what are the causes for it in ladies? Because recurrent or repeated delivery, vaginal delivery, makes the muscles in the pelvic floor, in the lower part of the body, weak. So once it is weak, the bladder can't hold more urine, and whenever pressure increases in the abdomen, the urine
She can hold
leaks.
it.
So that is more common in ladies, the stress urinary incontinence, most commonly after the repeated delivery, normal vaginal delivery. Then the next type, as I said earlier, is overactive bladder, which is more frequently seen in males when there is neurological diseases like when there is injury to the spine. Apart from that, long-standing diabetes, all this can lead to the neuropathy, means weakness of the nerves, which can lead to overactive bladder. Then in some people we'll have mixed, both stress and urge. And the last one, this overflow incontinence, is mainly seen when there is an outflow obstruction, that is prostate gland enlargement and stricture urethra. You can have overflow incontinence.
Okay, and what is the treatment for that?
The treatment for incontinence, initial, when the severity is less, when there is only a minor leak, initially we will start with behavioral therapy and medication. So what does this behavioral therapy mean? Here we try to train the bladder again. So bladder training, wherein we tell the patient to hold the urine for 10 minutes more, so that we slowly try to increase the gap between each voiding.
It's just like training.
Training the bladder. Yeah. So it is called as bladder training. Then we'll advise the patient to have double voiding, in the sense when he goes to the washroom, he finishes once and he is told to pass again once more in the same go, so that the bladder is more empty and he doesn't have the urge to void again. Then the other one is medications. So the medications, we have various drugs which can relax the bladder muscle and hold more urine. So apart from that, then we have surgery. When the severity is more, especially in case of stress urinary incontinence where the pelvic muscles are weak, we try to lift the bladder neck by using a small tape, which is called as tension-free vaginal tape. And it's a very small and less time-consuming surgery, wherein there is only a very small incision, less than 2 centimeter, and it is not seen outside also the incision. So it is a surgery which will give a good result. The patient immediately become continent.
Yeah. Dr. Shamir, we hear a lot about the kidney stones. What is it exactly and how does it form?
Well, kidney stones are a very common disease in Dubai or United Arab Emirates because of the climatic conditions and the food habits. The stones, usually if they are in the kidneys, they are painless, but when they fall into the tube, which is connecting the kidney and the bladder, they can cause severe pain. Most of the patients who come to the clinic ask, why do I get stones? That is a very frequent question they are asked. See, why we form stones is because, like any other solution, urine also has got two parts. One is the liquid, that is the solvent, and the minerals or the crystals forming inside that. We call it as solute. Solvent and a solute. So solvent has got water mainly, and the solute is the minerals. So for example, if we take a glass of salt water, in that we contain the solution. In that solution we contain the water and the solute as salt. So when does the salt precipitate is that when that solution becomes saturated. Like for example, you add 2 spoons of salt into the water, it will immediately melt, not in the melt, it will dilute in it, and no deposit will be seen. But if you keep on adding more and more salt, it is going to deposit. Why? Because that solution has become saturated. But in case of urine, if the urine becomes saturated, you are not going to get stones or crystals. Only when it becomes super saturated. That means you need to add so much quantity of solutes. What are the solutes? Solutes are nothing but the minerals in the urine. What are the minerals? They are the oxalate, calcium, uric acid, and phosphates. So when these minerals increase in quantity and the liquid part, that is the water content, comes down, naturally these crystals are going to deposit. And apart from that, in urine we have normal inhibitors of crystal deposit. That's why the urine has to become super saturated to become a stone forming solution.
Doctor, does the kidney stones run in the family?
The kidney stone diseases usually doesn't run in families. Around 98% of kidney diseases are environmental causes or because of the dietary habits. Rarely, around 1 to 3% of stone disease can run in families. Some disease because of the enzyme deficiencies called as cystinuria, it usually runs in families. Apart from that, most of the disease regarding stone disease is non-familial, means doesn't run in families.
And what are the symptoms of kidney stones?
See, when there is stone in the kidneys and if it is not blocking the urine flow, it is usually asymptomatic. But when it drops into the ureter, it is going to cause severe pain, which is one of the most severe pain. Apart from that, when the stone is there in the ureter, it can rub on the lining of the bladder and the ureter and cause some blood in the urine. Then if it is blocking to a good extent, it can even lead to infection and fever. And when the stone drops into the bladder, it can completely block the urine flow. So that the patient, so the patient won't be able to pass urine. So these are the various symptoms of kidney stones. Depending upon the position, the symptoms can vary.
What are the treatments of kidney stones?
See, the treatment options for kidney disease all depend upon the location and the symptoms of the patient. If asymptomatic and small in size, we can have a watchful waiting policy, wherein we ask the patient to drink a lot of water, at least 2.5 liters of water per day, and we hope that the crystals or the small stones are flushed out. But if the stone is big in size and if it is causing symptoms, depending upon the level it is obstructing, we have various treatment options. Like if the stone is in the kidney and is less than 1 centimeter, we have a treatment option called as shockwave lithotripsy, wherein the patient is made to lie on a table and we focus the shock waves onto the stone, and the shock waves literally blast the stone and the patient can go home same day. It is actually a daycare procedure.
This is external one?
External. The shock waves are sent from outside and the stone is blasted and the patient can go home. not all stones can be treated same way, because depending upon the size, as I said,
Yes.
when the stone is in the kidney and it is more than 2 centimeter, the best treatment option is a keyhole surgery, which we call as PCNL. That means percutaneous nephrolithotomy. Here we make a small nick in the skin and make a track into the kidney, make a hole in the kidney, go inside, pass the scope, see the stone, break it and remove the bits.
Impressive.
After that, the patient will be in the hospital for at least 24 to 48 hours, because since we are making a hole in the kidney, the chance of bleeding is very high. So he has to be observed in the hospital at least for 24 to 48 hours. Then if the stone is really big, more than 2 centimeter, we do the age-old surgery, that is the open surgery, which is nowadays very, very less than maybe 5%, we do open surgery. And when the stone is in ureter, that is the tube connecting between the kidney and the bladder, we have other options which are called as endoscopic surgery, wherein we don't make any hole, we pass the camera through the existing urinary meatus and then see the stone, break the stone with laser, put a stent inside and come out.
Okay.
So these bits are washed out along the side of the stent. And the stent which we have put inside will be removed after 3 weeks.
After a complete removal of a kidney stone, is there any chance that it might come back again?
Yes, the chance of getting kidney stones after complete treatment is very, very high. Usually by the end of 3 years, the chance of getting a stone is around 30%, and by the end of 5 years, it is close to 60%. That means when a person have a kidney stone, even after removal, the chance of him getting the stone disease is very, very high than a person who has never developed it. So it is always better to be very keen about your diet and try to be very strict on your dietary modification so that you will not develop the stones once again.
And doctor, what are the dietary modifications that it has to be done?
See, when we talk about dietary modification, the bottom line is have a mixed common sense diet. Don't have the same foodstuff very frequently. Apart from that, at least have 2 or 2.5 liters of water, depending upon your occupation and your hydration status, at least 2 liters or 2.5 liters of water every day. Then coming to particular foodstuff, mainly you have to avoid red meat, which contains a lot of oxalate and uric acid. So red meat means mainly it is the mutton
cows
and
maybe, yeah.
beef. Chicken, to some extent, you can have no issues. Apart from that, cheese, chocolates, and protein-containing foods like nuts, cashew, badam, pista, all that has to be reduced. It's not that you have to completely avoid all this, but have in a moderate and reduced frequency.
Yeah, smaller amount.
Then coming to the vegetables, you have to avoid leafy vegetables like spinach, cabbage, and tomatoes.
And Dr. Shamir, at the end, what's your advice to our viewers to prevent kidney stones?
My advice to the viewers is that always have a healthy diet so that you maintain an ideal body weight, and whenever you find a risk factor or when you identify a risk factor, don't hesitate to meet your doctor. Talk to him and get your treatment at the earliest.
Thank you, Dr. Shamir, for all of this useful information. Thank you for watching us.